I want to talk about the deaths in Norway, Sam, because this is something that got a lot of attention over the weekend. 33 deaths were reported in mid-January among some 42,000 people who were given the Pfizer-BioNTech vaccine in Norway. That sounds scary, but give us some context here, because it turns out that according to Norwegian health officials, there's no link between the deaths and the vaccine.
Right. So, frankly, if I was the Norwegian health officials, I would have waited maybe a few days before I spoke about these issues. We know, for example, that the Pfizer, BioNTech, and Moderna vaccines are being used in care homes in the US. And a rough estimate would be that about 1.3 to 1.5 million people in care homes, which would include, of course, a lot of people over the age of 70, 80, have been vaccinated with it. And according to the CDC data that we've seen up to last Friday, only 44 deaths have been reported. That's a very different number to what Norway has said. So I think officials everywhere, including California that's just coming out, need to be careful before they start sending out these messages, because people latch onto them.
You recently published information, Sam, on the coronavirus variants and how the vaccines work against them, or what I should say is how we know at this point how they work against them. Bring us up to speed, because I'm wondering about the timing of clinical trials that actually show the efficacy when it comes to strains.
Sure. So two things happened basically overnight, last night. One is that Professor Ravi Gupta's lab in Cambridge, UK, has looked at vaccines being sera from vaccinated people in the UK. So mostly, I think exclusively, Pfizer-BioNTech vaccine. After one dose, 3 weeks later, his lab looked at the ability of their sera to neutralize the UK variant. And it seems that people under the age of 80, they had 8 individuals in that group, showed very little difference in the ability of the vaccine to neutralize them. People over the age of 80, they had some issues with something like 50% falling meaningfully. So there is a risk there that has to be looked at. Perhaps a second dose helps. In South Africa, there's a different discussion going on. The vaccine hasn't been tested yet, but there was information last night that people, if you take a serum from people who've been infected with a coronavirus over the past 9 months, 50% of those seem to be unable to neutralize the South African variant. That's worrying, but I'm still hopeful that vaccines will retain a good level of efficacy for that variant too, but it needs to be proven.
Well, you're certainly not the only one who's hopeful. Bloomberg Intelligence's Sam Fazeli. Sam, thank you as always for your time. It's great to see you this morning.